shall we?
Yep.
Thank you for joining me, Dr. Umar. Can you please tell me what is coronavirus from an expert's perspective? Because so many people don't even understand what the virus is.
Well, thank you for having me. So coronavirus or coronaviruses, as the name implies, is a virus to begin with, and generally viruses have two broad categories. They're either an RNA virus or a DNA virus. This is mostly dependent upon the genetic materials that the virus have, and in this case coronavirus is an RNA virus. Coronaviruses as a group consist of so many different viruses, and notable among them are the causative agents of SARS, which is the severe acute respiratory syndrome caused by SARS-CoV or SARS-CoV-1, the causative agent of MERS, that's the Middle Eastern Respiratory Syndrome or camel flu caused by the MERS-CoV, and the causative agent of COVID-19, which is SARS-CoV-2, that is currently responsible for the current pandemic. So, majority of these viruses are respiratory viruses, and they gain their entry either through the nose, the eyes, or through the mouth. When they get into a human's body, they tend to replicate, and in the process of replication they destroy vital cells in the respiratory tract of humans, thereby causing diseases.
So this definition you just gave, I feel like is defined in a way that only medical experts like yourself would grasp what the real meaning is. Like for most Nigerians or for a layman, what do you think is coronavirus?
Alright, for a layman, we know that there are agents, there are things in nature that causes disease. And among these things in nature, we have different kind of things that causes disease, living things that causes disease. We have bacteria, we have fungi, we have virus. When we talk about in terms of size, there are fungi that are quite big, that sometimes we see them on bread, like bread mold, and we have bacteria that are too small to be seen with naked eyes. But when we use a microscope, we can see those. And then we have some particulates of living things. They are quite small, too small. Some of them are too small for the bacteria themselves. You cannot see them with normal microscopes. Some of them you require to use an electronic microscope, which is a very powerful microscope, an electron microscope, sorry, a very powerful microscope to see them. And basically they are just a cell that contains, or an envelope, a body that contains the genetic materials of the virus, and when it enters a person's body, it usually tries to replicate. That's the manner in which viruses replicate. In doing so, they tend to damage the organs or the body surface, the cells that they use for replication. So coronavirus, SARS-CoV-2 does that also. It enters through either the mouth, the nose, or the eyes, and in trying to replicate, it damages the surfaces of this organ, and it works its way usually down to the lungs, where it creates some damages, which leads to some cascade of reactions, immune reactions, and either causes morbidity, that's sickness, or mortality. That's the ultimate death.
Okay. So, do you think Nigeria's response to the coronavirus pandemic is ideal?
When you say an ideal response, the truth is there is currently no response that is considered ideal for dealing with COVID-19. But there are responses that are considered to be adequate. A good example of which is South Korean response to this outbreak. You see, South Korea engaged in massive testing and aggressive contact tracing in the early phases of disease. This successfully led to an early eradication of this disease in the country. But coming back to Nigeria, when this disease came to Nigeria, when we saw our index case, at that moment Nigeria had very few functioning labs that were capable of detecting or testing for this disease. And ever since, Nigeria has struggled to ramp up, their capacity for testing. This has significantly hampered the country's ability to respond to this disease. Currently, there are almost 10,000 cases of this disease in the country, majority of which are in Lagos. And what is more worrisome is that we still have one of the lowest testing capacity per capita, even in Africa. So you see, if we do not test adequately, there is no way we would know how much disease we actually have in the community, because there is sort of a correlation between testing and number of cases in any community that has this disease. So I would say we really don't know whether the 9,000, 10,000 figures we are getting from the officials are the actual figures, or the disease is causing havoc on the ground.
Going to the third question I have for you, do you think Nigeria had enough time to plan the response before the first case was recorded?
So, looking at the chronological order of events, the first case of, or the early cases of COVID-19 were discovered in Wuhan, China around December of last year. And about a month later, after the disease started spreading all over the world, WHO declared it as a public health emergency of international concern. That is around the 30th of January. Soon after that, about a month later, Nigeria got its index case. That's around the 27th of February 2020. That is almost 2 months since the initial discovery of the disease in Wuhan, China, and about another extra month after its declaration as a public health emergency of international concern by the WHO. By that time, about 50 countries around the world had already experienced a case of this disease. About 80,000 people were already infected with this disease worldwide. So, relative to these 50 countries, one can say that Nigeria had an ample time to prepare for this disease. But in emergency preparedness, when we talk about enough time, one had to actually look at the preparations that went into place or that a country already had in place before the occurrence of the first case of disease. I'm talking about emergency preparedness plans for highly infectious diseases like COVID-19. So, does such a plan exist? If it does, was it accessible to the appropriate stakeholders? And was it tested? How often was it updated? We have stockpiles, national stockpiles for this kind of eventualities. I guess these are questions that need to be answered, because for any serious country to deal with a crisis like this, they should have prepared for this long before even the first case of this disease. And by the way, we have been, anticipating and are well aware of a coming of a pandemic like this for a long time.
So, from an international perspective and as a healthcare professional, what do you think could have been done differently by Nigeria in this response to the coronavirus pandemic?
Well, the first step would have been to anticipate this crisis and to plan for it thoroughly, well before even the first case of this disease. Also, would have been to actually stock up on essential supplies like gloves, N95 masks, and personal protective equipment that could be used for a wide variety of infectious diseases. Secondly, if there is a formula that had worked in this crisis, it would be massive testing and aggressive contact tracing at the initial phases of the outbreak, before it turns into a community transmitted disease. And why do we do this, you ask? This is because this disease currently has no cure, so all we could rely on is to isolate, to find those that are capable of transmitting this disease and isolate them before they transmit it to other people in the community. And if I may say, this can still work for Nigeria, although we missed a critical window of opportunity that this approach could have, been more cost effective in terms of saving lives and requiring far less resources.
Well, this answer is being responded to in an ideal setup. The Nigeria that we both know that the healthcare practitioners are always in one trouble or the other. They aren't even being paid proper hazard allowance. Some of them have limited access to resources or research materials to prepare them for this, because there's a doctor that confide in me that he doesn't know anything about coronavirus. All they are doing is, a case of trial and error. Not that they have undergone any particular kind of research on their own. They just depend on whatever is being forwarded to them from the ministry or World Health Organization. On their own, they aren't able to do research to be able to ascertain. They are even left without PPEs. They have to buy for themselves before governments come to their own aid, and they have to go to the hospital every day. So your response is in an ideal setup. We all know that Nigeria is not a country for ideal policies. In that case, what would you advise doctors that are practicing, that have to go to work every day to do?
Well, I think I have to begin by, appreciating our doctors for their valiant efforts in combating this disease. And to be honest, you cannot wait for somebody to take responsibility or to be responsible for your own life and safety, especially in the situation that we find ourselves in. That is not to say that our government is not doing enough, but like I said, you do not want to build a house and lay the foundation the same day you want to lay the bricks. It doesn't work that way. Things should be anticipated, things should be planned for. Without that, even the most resourceful of economies, like here in the United States, you find that it was hard for them to procure some important and essential goods at the beginning of this pandemic, not less of a country like ours. So the damage has already been done in terms of preparedness. Right now, what we need is, and the government is doing a good job at that. They are trying to procure PPE, but procuring PPE at this point, even if we have the money to pay for it, is not an easy task. So for those that can procure PPE for themselves, they should go ahead and do so. As a medical professional, we are always updating our knowledge. So update your knowledge and hit warning from the NCDC. There are non-governmental organizations that are involved in procuring these PPEs for our health workers. We thank them. and we should also encourage them in doing so. So, in essence, at this point, the responsibility of their safety, more or less, is vested in themselves.
Some Nigerians don't believe the virus is real. Despite seeing cases and even deaths, they don't believe it is real. So, in all, what do you think is the ramification of this action? People having to still live and believe coronavirus is not real, and they go about their lives as if nothing is wrong without the use of, protective face masks or using hand sanitizers. They just want to live their life as usual.
Yes, that's a major problem. Polls have indicated that there are still Nigerians that do not believe in the existence of this disease, or they believe in some other, concocted conspiracy theory. What I want you to understand is that we cannot ask people to take responsibility for things that they do not believe in, things that they perceive to be fictitious or made up. So it is important, if we ever want people to take medical advice, to have already gained their trust, and we need to educate people about this stuff beforehand. I would say that there are things that Nigerian government should have laid foundation long before the occurrence of this disease. These are investment in stuff like health literacy, which is very important, and Nigeria is lagging far behind in this critical aspect.